care in hand. We're here to help, we understand. From home to healing, near or far, you're in great hands with Concierge Star. Concierge Star Nursing care that shines so bright. Professional, compassionate, day and through the night. Health, comfort, peace of mind, we're with you every day. Concierge Star Nursing, your care, your way.
Welcome back to Concierge Star Conversations. I am Marquetta Martin, and of course, I'm here with the woman behind Concierge Star Nursing, Miss Tamika Brown, RN.
Hey, hey, everybody. Welcome back. I'm excited about this one because today we're really getting into what Concierge Star Nursing is all about.
And I think we need this conversation because when most people hear the word nurse, they immediately picture somebody in the hospital.
Exactly. Scrubs, hospital room, medication cart, call lights going off.
And the infamous running up and down the hallway.
Exactly. And yes, that's nursing, but nursing can go far beyond the hospital.
So today we're talking about the other side of nursing. What happens when someone needs professional support at home? What about after surgery? What about someone who just came home from the hospital? Or someone who needs nursing education or support and doesn't necessarily need an emergency room?
And that's where concierge nursing can come into the picture.
So let's get into it, Tamika. What does a concierge nurse actually do? Explain this like I'm just hearing this term for the first time. What does a concierge nurse do?
Okay, so at its core, concierge nursing is about providing personalized nursing support based on the individual's client needs. Traditional healthcare can sometimes feel very rushed. You know, the doctor's in real quick and they're out real quick. You have appointments, different providers, discharge instructions, medications, follow ups, and sometimes patients and families leave thinking, okay, now what? Now what do I do?
Right,
Right?
right.
So, concierge nursing gives us an opportunity to provide more individualized attention within the services that we're able to provide.
So it's probably best way to clear this up is that you're helping fill the gap between the medical system and what happens to a person when they actually go home.
Now, that's a great way to describe that part, right? Think about it. Think about it like this: somebody's leaving the hospital. They've been given discharge paperwork and maybe several instructions, right?
Hmm.
Now they're home and they're trying to figure out everything that they were told or trying to remember everything that they were told to do.
Hmm.
Sometimes having a nurse available for appropriate follow ups, education, observation, or care coordination can make that transition feel more manageable.
And I think people sometimes don't realize how overwhelming discharge can be until they're actually sitting at home looking at all those papers. I myself can relate to this.
Absolutely.
They give you a booklet that's looks like a study guide,
Can't stick a
and
staple through
right, and
it.
you're just like, but what am I supposed to do?
Right. So especially when you're sick, right? You're
Mhm.
recovering, you're tired, or you're caring for somebody else.
So, would you say concierge nursing is replacing someone's doctor or health agency?
Of course not. Definitely not. And that's very important. And I'm glad you asked that. Concierge nursing isn't about replacing physicians or other healthcare providers. We work within our nursing scope and collaborate with the client's existing healthcare team when appropriate. It's just another layer of nursing support.
And I like that distinction, an additional support, not replacing your healthcare team.
Exactly.
So, Tamika, let's talk about the people listening right now. Who might actually benefit from something like this?
So there isn't one single type of client. You can be anybody. There's not one single type. So you may have an older adult who wants additional support while remaining at home. You might have a family caregiver who needs help or support. You may have somebody recovering from surgery post-op. You might have someone transitioning home from hospitalization. Or you might have a busy professional who wants a convenient wellness check in or health education.
So, Tamika, caregivers are often forgotten. Let's think about them.
Okay, definitely. So, family caregivers carry a lot. They sometimes go unnoticed just because they're family. We don't look at what the situation actually is and how hard they're actually working. So imagine you're caring for your mother, father, or spouse or another loved one. You're trying to manage appointments, understand medications, recognize changes in your person, work your own job at the same time, and take care of your family. Sometimes the caregiver just needs support too. That's all I'm saying.
And I can agree. They carry a very heavy load.
Heavy load.
And sometimes they just probably need someone who understands the healthcare to say, here's what this means, or you need to pay attention to this.
Right, exactly. Within the appropriate nursing roles, right?
Right.
Education and helping clients understand their care can be extremely valuable.
So, Tamika, let's talk about seniors aging at home.
Okay, let's talk.
Let's say my mother is getting older, but she's still independent. Does she necessarily need a full time nurse?
No, not necessarily. Every situation is different. I mean, it goes like a case by case,
Understood.
Some clients may simply benefit from periodic wellness visits or additional support. Others may have more significant needs that require another level of care.
Mhm.
Part of responsible nursing is recognizing what you can appropriately provide. And when someone needs to be referred to a physician or emergency department or home health agency or another provider, you're able to distinguish between all those factors and get the person to the right person or place that they need to be at for the right, or how we say, the appropriate reactions happen for that person. You know what I mean? Outcomes goes for that person.
Right.
Right.
So, again, just bridging the gap.
Yeah, bridging the gap.
Okay. So, let's talk about post op clients.
hmm
And then you've got your surgery clients.
Yes, my babies,
Mm,
especially outpatient and cosmetic surgery patients. People sometimes focus heavily on the procedure itself, but recovery planning is extremely important too.
absolutely. Like who's taking you home,
Mm-hmm.
who understands your discharge instructions,
Mm-hmm.
and who's helping you get settled.
Exactly.
So, what does Concierge Star Nursing actually offer? Anyone that's listening may be thinking this right now. This sounds good, but what can I actually call Concierge Star Nursing for?
Well, that's where our services come in. Private duty nursing. So first we have private duty nursing services depending on the client's individual needs. This allows for more individualized nursing attention, first of all.
And that's the difference between walking into a hospital
hmm
where your nurse may have several patients.
Exactly. You hit it on the tip. So the model is much more personalized when we're talking private duty nursing. You have a lot of one-on-one care. Everything is geared just, for your patient. You're working with that one patient and that's it. That patient gets your full undivided attention.
And that can certainly give the patient a sense of ease, because they're already dealing with the fact of their health, and that
Right.
can be very stressful.
Right.
So being able to speak to someone one on one and get a clear understanding.
Makes the world of a difference. Yes,
Absolutely.
ma'am. We also do RN wellness visits. Yeah, we offer RN wellness visits, and these can focus on things such as general nursing assessments, education, monitoring within the scope of practice, and identifying concerns that may need additional medical attention that you just may not be picking up on.
Right. And I noticed that you say medication education, which I think is very important.
Very important. It is. We're helping people better understand medications that have already been prescribed to them, nothing that we're prescribing. Things like what the medication is for, maybe reinforcing instructions and identifying questions they may need to discuss with their prescribing provider, but haven't yet had the chance to either catch up with them or haven't received a phone call back or, anything in that nature. We're here to assist.
So again, bridging the gap.
Bridging the gap.
Now, this is probably one of my favorites because I can see the need for a hospital to home.
Oh, yes. hmm So this transition home can be a vulnerable time. Anytime you're coming from hospital or say rehab, it can be very vulnerable. You know, you're down and you're depending on others to make sure they see your process through, right?
Mhm.
So our role may involve helping reinforce discharge instructions, education again, wellness follow-ups, and helping the client understand the next steps in their care.
Absolutely. Now, I think this is pretty cool that Concierge Star offers transportation services.
Oh yeah, we also offer transportation services to our clients. It's a major part of our model, particularly around appropriate post-procedure and recovery support, which is your BBLers, your lipos, and all that type of stuff. We do other pickups as well. It's not just in those general areas you have. Just if you need to go to a regular doctor's appointment, you know
Hmm.
what I mean. If the link systems, I ain't talking about them.
Right.
They're my people, been a long time. But if those your bus services or your transport services in the cities are taking too long, they're overbooked. Concierge Star Nursing is here for that. We offer
Absolutely.
transportation. You need to get to a doctor's office, we'll go with you. We'll send a nurse to go with you to
Boy,
make sure everything is good.
boy, I tell you, it sounds like you got everything connecting the dots. There's something, a concierge nursing
Mm-hmm.
offers something for everything,
For everything.
all under health.
That's exactly it. Connect the dots in care.
Yes.
Right? That's what we're all about. Connecting the dots in your care.
So, why would someone choose a registered nurse? Here's something I really want you to explain. There are caregivers, companions, CNAs, HHA nurses. So, what's the difference?
Well, every role is important, but every role has a different scope. A caregiver or companion can be extremely valuable for things like companionship and assistance with everyday activities, depending on their role. A registered nurse brings clinical nursing education, assessment skills, medication knowledge, patient education, and clinical judgment.
So, you're not saying one is better than the other.
Of course not, not at all. It's all about matching the right professional to the client's needs. Sometimes somebody needs companionship. Sometimes they may need a little assistance with daily living. Sometimes the situation requires nursing assessment or skilled nursing involvement. So you would need your nurse and not your um, unlicensed personnel assistant. You know what I mean?
Understood.
Yeah,
Understood.
right.
So, knowing the difference really matters.
Absolutely, absolutely. You want to know the difference in what your caregivers are offering you. You got to know that. Yeah.
I agree. So, Tamika, with your healthcare experience, what are some of the subtle things a nurse may notice and an average person might overlook?
Well, sometimes it's not one dramatic symptom. Some people think you just have to be bleeding out and it's not that. Sometimes it's not just one dramatic symptom. Nurses are trained to look at the whole picture. Changes in vital signs, mental status, breathing, mobility, hydration, skin condition, medication concerns, or changes from the client's normal baseline is what we like to call it. So it could
Hmm.
be a number of things that you're looking for. And when something is outside of its normal baseline, what we can manage, our job is to recognize that and escalate it appropriately.
Understood. So now let's talk about virtual care
Hmm.
because healthcare isn't only happening face to face anymore.
Right. So that's why we're developing Concierge Star Virtual Wellness to get into the telehealth side of healthcare.
Hmm.
There are situations where someone doesn't necessarily need an in-person visit, but
Right.
may benefit from an RN
Hmm.
wellness check-in, RN's education or follow-up, something as simple as that.
So give us an example.
Okay, let's say somebody recently came home from the hospital.
Hmm.
A virtual wellness session could provide an opportunity to review how they're doing,
Hmm.
reinforce their discharge education, discuss general wellness concerns, and determine whether something needs to be referred back to their provider.
Again, bridging the gap and helping the client understand the verbiage in layman's
Exactly.
terms.
Exactly.
That's awesome. And what about pre-surgery education?
Oh, yeah. So preparing before surgery is definitely important, right?
Hmm.
But what happens after surgery? We can help clients understand their existing instructions, prepare questions for their surgical team, and think through recovery planning. Because a lot
Right.
of times people forget about the end result.
Right. They're so nervous or excited about the before
Right.
and not understanding that the before is just as important as the after.
That's the after. That's your recovery phase.
Right. But you're not diagnosing someone through the video call, correct?
Correct. That's a distinction I want people to understand. I'm glad you brought that up. Our RN wellness services are not a replacement for their physician. Okay, I'm going to repeat that. Our RN wellness services are not a replacement for their physicians, emergency care, or medical diagnoses. We're providing nursing education and support within our, as an RN, professional scope of practice,
Understood. And I
right?
think the people need to understand
They
that.
have to understand it. Please keep your doctors, everyone.
Absolutely.
Yes.
Okay, so Tamika, let's make this real. I'm having cosmetic surgery tomorrow.
Okay, girl.
I'm getting everything done.
See, now you already stressing me out.
No, that's not the objective.
No.
Not at all.
Okay.
But I'm serious. Walk me
Okay.
through it.
Okay. So let's say you've chosen your surgeon, right?
Hmm.
And you completed all of your preoperative requirements. One thing you should also be thinking about is, what's my recovery plan? Right?
Because everyone thinks about the surgery day.
Exactly. But who's taking you home after the surgery?
Hmm.
Where are you recovering at? Who
Hmm.
has your discharge instructions? Do you have the supplies your surgical team told you to obtain? And who do you contact if something changes?
And there's where planning ahead truly makes a difference.
Yes, ma'am. Yes, ma'am. So, depending on the service arranged, the RN supported recovery may include transportation assistance, observation. It can include positioning assistance, reinforcing discharge instructions, wellness monitoring, and recognizing signs that require escalation to the surgeon or ER. It
Right.
can make the world of a difference. Concierge nursing doesn't replace your surgeon again. We're part of the support system helping you navigate recovery safely and appropriate. Again, please
Yes.
keep your doctors.
I was just going to say it's very important to
It's
understand that
very important. Yes.
concierge nursing is just a method of bridging the gap, helping you navigate to understand.
Right.
And then this way, if there's something that's needed for you,
Mm-hmm.
your nurse can also relay that to your doctor.
Right.
Because again, they have their terms and then they bring it back to us in layman's terms.
Right. There you go. You got it. You got it.
All right, Tamika, let's have a little fun here.
Okay.
Let's
Let's
do
go.
myth versus fact.
Okay. Let's go.
Let's see. Nurses only work in hospitals. Myth or
Big
fact?
myth. Big myth. Big myth. So, nurses, you can work anywhere. You can work in a hospital, clinics, home care, education, public health, like we all just were in 2021, right?
Mm-hmm.
Okay, insurance, even telehealth, like I just told you all about. Entrepreneurship is what I'm big on.
Mm-hmm.
Private duty, consulting, and more. There's so much you can do as an RN. We are really respected out here in the world. No matter what the naysayers say, we are professionals.
I must
Okay?
agree. As they would say back in 2021, essential.
Essential.
Okay.
Essential
Okay.
workers.
Okay.
Okay? Yes,
Okay.
ma'am.
Without the nurse, there is no completion.
You better know it.
So let's say this:
Mm-hmm.
myth or fact?
Okay.
Private nursing is only for the rich.
Myth. Myth.
Because when people hear the word concierge, they immediately hear dollar signs.
They do. Exactly. They do. I can't even say that. They do. Because when I talk about it, they're like, oh, how much does that cost? So listen, guys. Is concierge services are for everyone.
It all depends on your actual need, right?
Exactly. It's every plan is individualized, and the cost is not. What would you pay for your life? What would you pay for your life?
Yeah,
Right?
that would
Okay.
definitely be the thought.
I'm just gonna sum it up that way. What would you
Hmm.
pay for your life?
Right,
Right?
right.
So no one's out here to rob, kill, or steal, right?
We're here
We're
to help.
out here to help. I am a nurse and I am truly dedicated to my profession. And I am dedicated to what the concierge nurse lifestyle is all about. And it's all about connecting the dots and care.
Right. So, what about virtual nursing? Isn't it real nursing? Myth or fact?
Is it real nursing? Definitely a myth. It is real nursing. It is definitely real nursing. Um, we can discuss education, follow ups, observations, communication, and care coordination. We can do all things. So, yeah, virtual nursing is real. Anything we can do in person, we can do on telehealth, right?
Agree.
We're
Yeah.
there. We're there as the physicians are doing it. You
Right.
know, what makes it different for
Right.
them from us?
Right.
We're knowledgeable.
Mhm.
We all went to school. We graduated. We
Mhm.
all degrees.
Mhm.
We are licensed.
Mhm.
Okay, so with the proper utensils and degrees and supplies as the physicians, I say nurses, we can do this also. Okay, this is not a myth. This is a true thing. Yes, we can do it.
So, myth or fact?
Mm-hmm.
Receiving care at home means you're getting lower quality care.
Oh, that's definitely a myth. That's definitely a myth. You're getting better care at home. I'm a witness to this one. One-on-one care equals better care. Point blank, period.
Yeah, again, that one-on-one personalized
Yeah.
care is also always important. So, I got one more.
Okay.
If I have a concierge nurse, I don't need a doctor anymore.
Absolutely false.
I
Please, again, keep your doctor.
would agree.
Please keep your doctor. Your doctor will coordinate everything for you. Your doctor's going to diagnose you, give you your prescription. They're going to do everything for you, refer you to your specialist. Your doctors do all of that. I am not a physician. I am an RN and I'm very knowledgeable and I can be the mediator in the middle. Any RN can that has been degreed, licensed, certified. We can do just what we can do up under our scope of practice, which includes all of these things that I have talked about today.
Great. So let's go through some quick questions. Okay.
Okay.
All right. Rapid round of fire.
Uh oh.
Don't
Okay.
think too hard.
Okay.
Favorite thing you like being a nurse?
Being a nurse. I just love being a nurse. I love what I do.
Hmm. Hospital nursing or concierge nursing?
Don't get me in trouble. But I'm definitely going to say concierge nursing.
Agree. Now, the biggest misconception about nurses.
That we can diagnose or write a prescription.
Right. Now, one thing every family caregiver should know.
To advocate. Advocate for your person
As the saying goes, a closed mouth doesn't get fed.
at all.
So if you don't ask, you won't
You
know.
won't know.
Hmm. Now, one thing about surgery patient should plan one thing that a patient should plan before surgery.
After surgery, your recovery.
Because again, it's always the before that we think
Mm-hmm.
about,
Mm-hmm.
not putting the same emphasis on the after.
Right.
Okay. Now, give me one word that describes concierge star nursing.
Compassion. All right, Marquetta. Now it's my turn.
All right.
You've had fun asking me questions. Now I'm going to ask you a few so our viewers can get to hear you talk a little bit about concierge nursing, how you feel.
Okay.
So tell me what's something you learned about concierge nursing that surprised you.
Well, the fact that they can do the telehealth, I always thought that was just the doctor's position.
Mm-hmm.
But because concierge nursing does bridge the gap between the doctor and the patient,
Mm-hmm.
helping them to understand. And then, too, the fact that a nurse, I'm not saying doctors don't have compassion,
Right.
but in my experience, I feel that the nurse has a little bit more compassion and they take their time.
Right. Right. Right.
So that's what I like.
And that's who you see the most.
Hmm.
You know, so we develop a relationship
Hmm.
more with our patients, I believe, than the
Hmm.
physicians do. The physicians, maybe like the family physicians, may see their patients more regular and they develop a relationship. But I think just from working me personally, I think the nurses do. So, what service do you think families need to know more about?
I think that big one would refer back to telehealth,
Telehealth,
because I
yeah,
don't think a lot of people out there understand what telehealth really is.
and that a nurse
You
can
know,
actually help you.
to me. I mean, once it was explained to me, I feel it's more of a convenience for the patient,
Exactly.
because let's for instance, you have your older people.
Mm-hmm. Mm-hmm.
It's hard for them to even get up in the morning to get dressed.
Mm-hmm. Mm-hmm.
So and then let's say their appointment's at 11,
Mm-hmm.
they're probably getting up at 5 o'clock in the morning just to get to the doctor's appointment.
Right.
Whereas if they have a telehealth visit, what, 15-20 minutes, be
Done
there
and
by your
over.
phone,
I got you.
and it's easy.
It's
You still
easy.
go on about your day, and you didn't have to break a sweat to get out the
Yep.
door.
I totally agree. I totally agree. Now, after doing this podcast with me, has the way you look at concierge nursing changed? Or at nursing period changed?
No, now, just so that the audience knows, my background has been in finance.
Mm-hmm.
I've always had a liking for nursing,
Mm-hmm.
the compassion, being able to help people.
Mm-hmm.
So it's still there, but with coming in on this journey with you with Concierge Star Nursing,
Mm-hmm.
it's just increased that want even more to learn and, to help provide for the patient.
Okay, good. So, what's one topic you want us to tackle on a future episode?
Now I'm going to take this one a little
Okay.
personal,
Mm-hmm.
because I'm on a journey myself,
Mm-hmm.
and a lot of people
Mm-hmm.
nowadays are taking the GPL-1.
Okay,
So I think that would be something to talk about,
that's
so
a great
people know
topic.
the pros and cons.
Look out for that episode, guys. GPL1 topic. Look out. That's a great one. I like that.
Yeah, I think so too.
Okay.
All right, Tamika. So before we wrap up, it's time to add a new part to the show. It's called Ask the Nurse. So let's see here. We have a listener. They're asking, how do I know whether my loved one needs a caregiver or a nurse?
Okay, so that's the first question. All right, so what kind of help does your loved one actually need? Pretty much is what you're asking. So let's say if it's companionship or assistance with everyday activities, one type of caregiver may be appropriate. Just a caregiver to sit in and, you know, um, help with light things around the house, maybe laundry or washing dishes or assisting in cooking, or just again like companionship, someone to sit and talk to. Then again, if there are skilled nursing needs, assessments, complex medication concerns, or other clinical needs, nursing involvement may be appropriate. Like you may need an RN at that point because they're the ones you're looking for your clinical judgment areas.
Hmm.
And sometimes the answer is actually a combination of both services. You may need some simple things done and you may need some more intensive things done. So just depending on, again, the person, and each situation is different.
And this is why individual assessments really matter.
Exactly. Care should not be one size fits all.
Like the spandex.
Exactly.
Uh, so now, if you came into today's episode wondering, what in the world is concierge nursing? Hopefully, we have been able to help you understand that nursing doesn't stop at the hospital doors.
Sure does not. Concierge nursing is about meeting people where they are and providing personalized nursing support within our scope of practice, our meaning our ends. For Concierge Star Nursing, our goal is to combine professional nursing knowledge with compassion, convenience, education, and personalized care.
And I think today's phrase needs to be
Connect
connect
the
the
dots
dots
in
in care.
care. I like that, Marquetta.
Yeah. So if you enjoyed today's episode, share it with someone who needs to hear this conversation.
And if you have a question you'd like answered during Ask the Nurse, send it to us. Your question might be featured on an upcoming episode.
And don't forget, visit conciergestarnursing.com to learn more about Concierge Star Nursing's services and academy.
And make sure you subscribe because we've got a lot more conversation coming.
So until next time,
Care with heart, lead with purpose.
Yeah. Yeah. When you need a caring hand, we're here to help, we understand. From home to healing, near or far, you're in great hands with Concierge Star. Concierge Star Nursing, care that shines so bright. Professional, compassionate, day and through the night. Health, comfort, peace of mind, we're with you every day. Concierge Star Nursing, your care, your